The News4 Jax I-Team Trust Index team is fact-checking Governor Desantis' statement that school children have what he described as an incredibly low risk of getting the coronavirus.
The governor made that claim and similar ones during recent news conferences while discussing plans to reopen Florida's schools in the fall. As of last week, more than 17,000 children had been diagnosed with the virus, and that made up roughly 7% of all of the state's cases at the time. Tarek's joining us now with what he learned about kids and coronavirus. Tarek.
Well, it's a topic that is on the mind of practically every parent in America right now. Is the school setting safe for their kids? According to the governor, it's not especially risky. We're finding out if this is accurate or not.
I don't think there's anybody who can make an argument that this is especially risky for kids. The risk of corona, fortunately for students, is incredibly low.
Florida Governor Ron DeSantis made these statements while talking about the importance of getting Florida students back in the classroom. Assertions intended to provide parents with some comfort about COVID-19 in a traditional school setting. But is what the governor's saying 100% true?
No, the risk isn't incredibly low.
Dr. Jeffrey Goldhagen, a pediatrician at UF Health, says school children will indeed be at risk of contracting the coronavirus in school. And at the same time, he says someone under the age of 18 does have a decreased chance of getting COVID-19. Another important factor to consider, according to Goldhagen, is how much more exposure to students and staff the school children will get.
If a child, for instance, in the school system or wherever is has the risk of a third of an adult, but has 3 times the number of contacts, then their capacity to spread the disease is the same as adults.
According to Department of Health statistics, statewide as of last Friday, 17,073 people under the age of 18 contracted COVID-19. 213 of those patients have been hospitalized at some point, and only 4 people have lost their lives. Goldhagen says children are less likely to get infected and less likely to become symptomatic. But he says calling the risk incredibly low isn't 100% true if you look at how many other kids and staff the students will come in contact with.
We have to move away from this perspective that children are not at risk of getting infected with the disease, that they're not at risk for spreading the disease, and they're not at risk for actually getting symptomatic from the disease. Those assumptions are wrong.
Now, based on this pediatrician's experience and the state data that we've gathered, we give the governor's statement that there's, quote, an incredibly low risk to school children, end quote, the rating of be careful on the trust index. Medical experts add that masks do reduce the transmission rates, but getting the kids to wear the masks, that consistently is difficult, according to the experts.